what are some of the principles around how the clinician interacts with a digital or a digital platform strategy or digital front door strategy?
Well, it's very similar to the old school EHR decisions, which is, well, heck, think about this. When we implemented CPOE, we asked really, really smart people with really good education to do something that they've been doing very successfully forever, and to do it with really crummy tools that were very immature and had no immediate benefit for them. I mean, that was CPOE summed up in its early days. And I think as we navigate the digital world, we've got to have that similar understanding with our providers. They don't all have the same level of comfort with technology, and we've got, where possible, to allow them to have an influence on the context. If we get the technology right, Bill, and if we can pick vendors who are committed to interoperability in a real true way, then our clinicians have the ability to decide on which one has the best clinical content.
Right. And
And
so
I think that's important.
so that's where the platform comes in. What kind of, so you mentioned this a little bit. What kind of conversations do you have with your vendor partners? So you're saying, hey, we've got this platform and this is how you're going to plug in and this is how you're going to interact across the LifeBridge ecosystem.
Yeah.
How do vendors respond to that, and how do they? Well, I guess how do they respond to that is the question.
Well, it hasn't always been easy because, as you know, some vendors believe and want to solve it all. And so if you're not buying every one of those widgets, objects, and use case tools from them, they don't want to play. That's one end of the spectrum. The other end of the spectrum are folks who are just pure tech companies and they have no content. And so when you have a gap in content, they don't even have a default standard for you. So they're interesting conversations. And there hasn't been a one size fits all. We've been doing a lot of navigation in the space. And it's hard because you might have a vendor that's got the best clinical content for your digital journey, and yet they are very immature from their interoperability perspective and really don't have the technical capability to fit into your ecosystem. And so I think that's where there just needs to be both a flexible and an innovative mindset, meaning that sometimes you have to accept in the short term that you're going to make a decision along something that's more proprietary, as long as your contractual construct creates an expectation that the interoperability, that your vendor partner will commit to the interoperability coming along, and that there are mutual risks and rewards if that does or doesn't happen. As technologists, we can't just come up with our little requirements document and say, if you can't meet any of these needs, you can't play in my space. We could do that, but then we might lose the value of the richest content for the context. And the reverse is true, which is if you've got something that's highly appropriate based on content and absolutely will never fit into your interoperability ecosystem, then it really can't be a singular or close to a singular user experience. Yeah. So they're tough conversations, and not a lot of people get me. When I'm having these conversations with point solution vendors, they just want to tell me what a great job it does for COPD, CHF, telehealth, just fill in the blank, because they don't care about or understand the broader context that we're hoping to manage with the digital strategy.